Yes, thanks for the introduction, and thanks Eva for introducing the webinar. And good morning to all those in the Americas. Good afternoon to those in Europe, like me, and in Africa, and good evening to those in Asia. So it's a pleasure to be sharing some thoughts with you today. We have a quite informal webinar, and Eyas is kindly moderating it. So feel free to send questions as we go through. So let me share my screen here, and then we can kick off. So the topic today is on decision-making for enhanced health security. This is based, I have a long-term interest on this topic, and this has been exacerbated by the pandemic. But what I want you to do today with us together is to explore a bit the historically this, or to take a very long perspective on this topic and see where we were in the past, where we are now at the present, and where we can be in the future. And hopefully this also gives us a better understanding about the challenges that we just experienced with the COVID pandemic, but also a kind of long-term perspective on such an important topic for humanity. So let's start. Just go to, just give me. Let's start with the past and look at the history of pandemic. So the topic today is based on a book that I have just released. And one of the good things about the book was to study a bit the history of diseases and pandemics. And if you just look, for example, during the contemporary era, so since Christ was born, we have a long tradition of pandemics, starting with the Antonine plague during the Roman Empire, the huge Black Death in the 300s that killed probably half of the human population, and then smallpox in the 1500s and 1700s, coming to Spanish flu in the 1800s, and the AIDS pandemic, which actually was very large. And now the most recent one is the COVID-19 pandemic. There are uncertainties about estimates here, but the death rate is probably between 3 million and 12 million deaths, and here is represented as 6 million deaths. So this is just to show that there is actually, we experienced recently a pandemic, but there is a very long tradition and periodic pandemics. If we see the death toll, it's also a good idea to think about the COVID-19 pandemic in relation to past pandemics. And we can see actually that is, relatively speaking, despite the horrible things that we experienced, relatively speaking, it's not one of the largest ones that humanity has experienced. Black Death was by far the biggest one, both in absolute and relative terms. But smallpox also was a big killer, with around 56 million people killed throughout history. And indeed, I'm going to explore a bit this disease because one interesting thing about researching for my book was discovering the very first decision analysis, as far as I know, that has been conducted, quantitative decision analysis. And surprisingly, actually, it was done on a health security decision, and it was about smallpox. So let's analyze and understand a bit the history of smallpox and how this very first decision analysis was developed. So smallpox is a very old, ancient disease, and indeed the Egyptians were already suffering from that. So there are mummies which have been actually affected by smallpox, and we can see this by the damage on their faces during that period. So it was a disease that then expanded to Asia, and then Central Asia. And it came to Europe via two major events. One was the Arab conquest of the Iberian Peninsula from 700 to 732. So they basically invaded from Africa, Spain, and what is now Spain and Portugal, and brought with them smallpox. And also the Crusades in the 1000 years, in which basically they went there to fight the Muslims, and again, this created opportunities for exposure.